Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Kim Smith-Whitley this evening. She's Executive Vice President and Head of Research and Development at Global Blood Therapeutics. She's joining us on the program to discuss sickle cell disease and some of the health disparities that are affecting patients, a few of the challenges with access to care, and a little bit about how new developments may impact the community. Welcome to Health Professional Radio. Dr. Smith-Whitley, thank you for joining.
Thank you, Neil. Thanks for having me.
Give our listeners a bit of background about yourself and tell us a bit about what it means to be Executive VP and Head of Research and Development at Global Blood Therapeutics.
I'm a pediatric hematologist that's been in practice for over 30 years with a focus on caring for young children living with sickle cell disease. In May of this year, I transitioned to Global Blood Therapeutics as Head of Research and Development, with the hope of being able to have a broader impact on the sickle cell community. I was drawn to GBT by its dedication to this population and for their interest and promise of drug development that could be disease modifying for children and young adults with sickle cell.
Were you intimately aware of sickle cell disease prior to joining GBT? Or was it early in your career that you became interested in sickle cell specifically?
It was. I became interested in sickle cell when I was in medical school. I was very drawn to this population because of the health disparities that they faced for decades. Despite the fact that the first individual with sickle cell disease was described in 1910, today we only have 4 disease-modifying therapies for sickle cell. And it's really important to be able to look at all of the scientific discovery that came through the investment in this population as far as time was concerned into the genetics of sickle cell disease, but yet that is not translated into clinical improvements that have markedly improved survival for this population. And currently, despite these 4 disease-modifying therapies, we still face the issue of early mortality in individuals with sickle cell disease. I'm hoping that will change because we've only had 2 of these disease-modifying agents, one for pain and one for the underlying pathophysiology of sickle cell, Oxbryta, since November of 2019. So hopefully we'll see an impact on the community eventually, but this is a population that's been under-recognized and underserved.
What is sickle cell and who is affected most by this disease?
Sickle cell disease is an inherited blood condition that is a result of inheriting 2 gene variants for normal hemoglobin, one from each parent. If you inherit the sickle gene from each parent, that's the SS type of sickle cell disease, which is the more common form occurring in about 65% of individuals. And unfortunately, that sickle hemoglobin, under certain conditions, polymerizes or stacks upon itself. And that stacking actually changes the properties of the red cell, and the cells tend to form into a sickle shape. And that leads to early destruction of red cells, or a process called hemolysis, and also another process called vaso-occlusion, where you actually impede blood flow and oxygen delivery to tissues because of these blockages of small blood vessels and capillaries in the body. If that blockage occurs leading to the brain, that can result in a stroke. If that blockage occurs in a bone or a muscle, that can lead to unpredictable pain episodes. But over time, it results in end organ damage, and that's the primary cause of premature death in individuals with sickle cell disease.
And who is mostly affected as far as ethnicity or region in the planet, things of that nature?
You know, one of the things that is interesting about genetics is that there's usually a reason for survival advantage when you look back historically, and that's the case for sickle cell. Mm-hmm. Sickle cell trait, having a normal adult hemoglobin gene and one for sickle, that actually protects you from severe complications of malaria. So where malaria was endemic, there was a survival advantage for those with sickle cell trait. Mm-hmm. So that gene frequency is common in sub-Saharan Africa, in the Afro-Caribbean, the pattern of the diaspora, in India, and in the Mediterranean base. So wherever malaria was endemic, that's the population that was impacted. And so now primarily impacts communities of color.
You said that you were drawn to this community because of some of the disparities that this community had to deal with. Why is understanding what sickle cell disease patients face, why is it important, and how is it going to help health professionals care for them in a much more insightful manner?
I think it's important to understand that this community has really not received the attention and the medical care that they honestly deserve. They need access to high quality care. And high quality care not only includes access to disease modifying therapies and novel therapies, but also access to respectful, compassionate care. And because of the stigma of sickle cell being associated with pain episodes, many individuals have been labeled as being drug seeking. Mm-hmm. And then because this has impacted communities of color, of course, all of the stigma of racism and social injustices has impacted this community, just like it has other communities. But now we're dealing with a community not only of color, but then having a chronic illness on top of that has made the health inequities also prevail. So I think that individuals with sickle cell disease deserve high quality care that is culturally sensitive, that makes sure that they have access to disease modifying therapies, particularly novel therapies that are focused on changing the underlying pathophysiology of sickle cell, which is that sickling or that sickle hemoglobin polymerization, and really trying to impact a population with a chronic illness before they develop in-organ damage. So really being focused on trying to get therapies to young people that can continue across the lifespan. And I think that the healthcare community really needs to be aware that sickle cell hasn't gone away. I mean, many people believe that when sickle cell trait was brought to the forefront by the Black Panther movement, and really the screening that was in the communities was abundant, because the attention has fallen away from sickle cell. Many people just don't believe it's an issue anymore, and that's not the case.
Well, where can our listeners go online and get some more information about GBT and what you're doing to enhance health equity within the sickle cell community?
I would encourage them to visit Global Blood Therapeutics website at gbt.com, learn more about what GBT is doing to improve the lives of those living with sickle cell disease, and really the efforts that are underway to address some of the healthcare gaps and social injustices that this community has faced.
Well, Dr. Whitley, I appreciate you joining us here on Health Professional Radio.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Kim Smith-Whitley, Executive Vice President and Head of Research and Development at Global Blood Therapeutics. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.